I'm Melissa Hampton, and I'm the Director of Health Information Management at Phoebe Putney Memorial Hospital. Phoebe Putney Memorial Hospital is the largest hospital in our network of a Phoebe Putney health system. We're a 450-bed hospital. We provide basically all services except for organ transplants. We don't do transplants. We are a teaching facility. We have a family practice residency program along with pharmacy residency and many other allied health student professional residency programs. We use ChartMaxx for our HIM department, for the medical record completions, all aspects that typically go with that. We also use it in our registration department. We use it in our patient financial services division, and we've also branched it out into our human resources department through the cabinets, drawers, and folders functionality, and payroll, other ancillary departments such as that. We also have one of our sister hospitals, Phoebe Sumter in Americus, Georgia, that are also using ChartMaxx for the same functionality, and we'll be bringing on our remaining hospitals within the next 2 years. The major benefit from using ChartMaxx has been our improved processes and efficiencies with chart completion and our DNFB, improving our coding rates. Before ChartMaxx, our physician completion rates for Joint Commission standards was about 20%, which clearly met the standards for Joint Commission. But with ChartMaxx, we've been able to lower that to closer to 5%, meaning only 5% of our records now go over the 30-day mark. It's simply because ChartMaxx has allowed us to have our physicians have a much quicker turnaround time on getting their charts and getting it completed. For our coding standpoint, the efficiency of being able to route and control what charts got to coders when and to which coder, and being able to send our coders home through the functionality in ChartMaxx has allowed us to see a 66% increase in coding productivity. So we've seen our DNFB days go from an average of 9 or 10 days after discharge before final bill. We're now going just a little over 4.5 days with a suspense day of 4. So we're almost right at our suspense day based on ChartMaxx functionalities. My job is easier because I used to in the mornings did what I called the walkthrough. I had to walk through the department, look at the shelves to see what the backlog was, to see who needed to be doing what. I would have to walk through the department, see what shelves are backlogged, who had what on their chart, their desk, and go through the process. Now I can simply pull up a one screenshot in ChartMaxx. It tells me what the backlog is for every functionality within ChartMaxx and allows me to manage my staff quicker and efficiently because I can just look at that one screen and know who has what and what's still pending. What has improved the most money for the hospital has been the improvement in the coding productivity. By having that coding productivity and being able to turn around charts and turn around billing and reduce AR on the back end has tremendously allowed us to save financially for the organization. We use ChartMaxx not only in HIM registration and patient financial services, but we also use it for the cabinets, drawers, and folders within human resources, payroll, and several other little ancillary departments. MedPlus has been great. Out of all of our vendors, their support staff seems to have the quickest turnaround time. You very seldom have a voicemail that there's not a real person answering the phone that can get you to the right person. ChartMaxx has met all the promises they've made us. It's delivered everything that we had intended for it to do, and even provided us services we never anticipated getting in the beginning.